Okay, Mr. Ramos, so thank you again for sharing that information with me. So now we're going to move on, and this part is kind of a review of all the body systems. So you're going to notice I'm kind of going to be jumping around in different parts of your body, okay? And this is just to kind of get an overall view of what's going on. When I ask you these questions, you kind of want to just answer yes or no, and we want to keep it confined to like the past couple of months. So for instance, if I ask you if you've been getting fevers and you were getting a lot of fevers maybe like back in February, we kind of want to just stick with what's been going on recently. So anything from like mid-August to today is where I want you thinking about these things. You understand? Okay, great. So first, let's ask about, have you noticed any hair loss?
No hair loss.
What about any issues with sinuses?
No.
Nothing? Have you noticed any red eyes?
No.
Have you had any changes in your vision?
No.
Okay. How about any earaches?
No.
Any ringing in your ears?
No.
Any hearing loss? Nothing. Have you been experiencing any bloody noses?
No.
No? What about runny noses?
No.
No? Okay, that's good. Have you had a sore throat?
No.
Have you had any hoarseness?
No.
No? Have you noticed any lumps in your neck?
No.
What about pain?
No.
Okay, that's good. As far as your breathing, have you had any trouble breathing?
No.
Have you had any congestion? Okay. What about cough? Now talking a little bit about your heart. Have you noticed any palpitations?
No.
Been kind of violent? No? What about any chest pain pertaining to kind of your heart?
No.
Nothing like that. What about high blood pressure?
No, I haven't been told about that.
No? Okay. Moving down to kind of your abdomen and digestive tract, any pain in your abdomen? What about lumps? Have you noticed any masses anywhere?
No.
Okay. Have you had any issues with diarrhea?
No.
What about constipation?
No.
What about nausea?
No.
What about vomiting? So everything's kind of okay there?
Yes.
Okay. Now in your pelvic region, have you felt any pain in your pelvis?
No.
What about lumps or masses? Okay. Have you noticed any changes in how often you're urinating?
No.
No. Or the flow when you urinate?
No.
How about any blood in your urine? Have you noticed any other discharge?
No.
So everything is kind of good down there also. Okay. What about your skin? Have you noticed any moles?
No, not more than usual.
No more than usual? Do you usually have
Not moles, I
No?
guess, but maybe like birthmarks.
Okay.
That's how you meant.
marks? Okay. So you have birthmarks, but they're not changing.
No, they're not.
Okay, that's good. What about rashes?
No
No?
rash.
Any patches of dry skin?
No dry skin.
Okay, that's good. Any ulcers, lesions? Okay, good. Have you noticed any numbness anywhere in your body?
No.
What about tingling? Nothing like that?
No.
Okay. Have you noticed if in the past couple of months you might have cut yourself, that the bleeding time was different, like it took longer for it to stop bleeding or nothing like that? Okay, I know that's kind of a really weirdly worded question. I apologize. Let's see, what else? How about, have you noticed if you've had any recurrent infections? If you just kind of keep on getting infections, or your infections are lasting longer than normal?
No infection.
Have you been feeling tired lately?
No.
Okay, that's good. Have you had any headaches? Seizures?
No.
Nothing like that? Okay, so talking a little bit about kind of like your musculoskeletal system, have you noticed any stiffness in your joints?
No.
No? Any swelling?
No.
Nothing? Have you noticed if maybe like your range of motion isn't what it used to be?
No.
No? Any back pains or
No
back
back.
pains? Nothing like that? Okay, that's good. Have you noticed if you've been excessively thirsty the past couple of months? Or hungrier than usual?
Not more than usual.
Okay, have you noticed any excessive sweating?
No.
Nothing like that? Okay. What about kind of your mood? Have you been feeling depressed? Have you been feeling anxious?
No, not more than the usual.
Not more than usual? And how much is more than usual?
The
Or not?
usual is just
What's
like
usual?
tests.
Okay, so
stress,
kind of the
those
normal
stuff.
reactive stresses. What about angry? Have you been feeling angry?
No, not angry.
Have you had any suicidal thoughts?
No.
About any homicidal thoughts?
No.
So see, we kind of covered a bunch of different regions, systems of the body. Is there anything that I need to know, any other symptoms or problems that you've been experiencing?
No, that seems to be a pretty good overview, and I seem to be
Okay, all right, sounds great. Thank you very much for sharing that with me. Call.